Welcome, faculty, family, friends, and staff. It is an honor to stand before you today in celebration of our success and in appreciation of your support. If we are to live fully, we must love as though we have never been hurt, dream as though our hopes have never been dashed, and take steps toward the future as though life has never given us pain. Before my daughter was diagnosed with congenital heart disease with a poor prognosis, before spending every day at the bedside while she was at the hospital, before these life-changing moments, I hated hospitals. Every single time I walked into a hospital, I could feel my heart break. I hated to see people suffering and have disease take over their lives. To me, hospitals were places where people suffered and died. Everything changed when the hospital became my daughter's home for the first 3 months of her life. I began to see hospitals as places where doctors and nurses became advocates to promote and restore health. It was a place filled with living and breathing people who were dependent on the healthcare team to implement optimal care. More than anything, it was a place where I witnessed hope being born. My hope was born the day that I looked at my baby girl, 5 pounds, 6 ounces, being wheeled into the operating room at 6 days old for open heart surgery. And I said, "Baby girl, don't you hold on for us. When we walk away, if you need to let go, it's okay." We have become conditioned in life as individuals, society, and as a healthcare team. We have become conditioned to believe that strength is associated with control and by holding on. But we fool ourselves. When you are at the bedside of your loved one, it is only natural to want to hold on for a little while longer, to keep reality from becoming a memory. Whether it's a patient who has cancer, heart disease, acute or chronic illness, whether he or she is old or young. It seems so wrong for my daughter to be born into this world to suffer and not have a chance to live. I thought, this isn't fair. This isn't how it's supposed to be. This little girl, she hasn't even had a chance to feel the outside world. I want her to be able to feel the sun, to touch the water. I wanted her to smell the air. I wanted to be able to hold her in my arms and to hear her voice cry. It's what I want. In the face of my greatest adversity, I wanted control. But I learned it's through surrender that strength and hope unveil itself. Bringing my daughter home from the hospital, it was the single most happiest day of my life. But as I walked out of the hospital, there were new faces, families, and parents walking in. And they had tears and hopelessness in their eyes. And I thought, I'm going to be a nurse. I'm not only going to serve as the parent who held my critically ill newborn in my arms, I'm going to be the nurse that offers emotional support and optimal patient care. I want to be the nurse who sits with you, takes your hand, and that is there for you when there are no words strong enough. If there is one lesson validated through nursing school and experienced while going through a medical crisis with my daughter, it's that life does not happen in black and white, and progress doesn't occur overnight. Oftentimes, it's not the big steps that we've taken, it's the little steps in between. I encourage you to stay committed. When the world says give up, hold on. And when the world says hold on, it may be time to let go. It's when we listen to the voice on the inside. It's in those moments that the world falls silent, birth endures, and the small whisper reminds you you are exactly where you are supposed to be at this precise moment in time. 2 years of nursing school has taught us that time does not stand still, and it is best reflected when we live our priorities without compromise. As a class, we have formed friendships. We have spent endless hours learning, studying, and growing together. We have shared hugs, encouragement, time, tears, and hope. We have been more than a team of clinical students, more than a circle of friends and cohort of students. In many ways, we've become a family of interdependence, where we have learned to lean on each other. We found acceptance for our struggles and an awareness of our limitations. We have not only learned how to prioritize the care of our patients, but we have courageously learned how to care for ourselves. As you set forth in your chosen careers, I challenge you to step through every obstacle as an opportunity to soar towards your unique potential. My fellow students, today we celebrate our achievements with relentless momentum. We have accomplished a thorough understanding of the nursing process, as it outlines the assessment, diagnosis, planning, implementation, and evaluation of our patients. Today, I ask that we apply this process to our own lives. May we assess our individual strengths and abilities, diagnose ourselves as leaders within the nursing profession, plan our delivery of exceptional patient care, implement our diverse skills, and continue to evaluate our commitment to excellence as it's paved throughout our individual journeys. We have conquered the challenges, grown through our weaknesses, strengthened our skill sets, and persevered with fierce determination. We are ready to embrace of our passion and give of our heart. Class of 2012, as you step out and live your dream, may you always remember and never forget, to the world, you may be just one person, but to each and every